Hi, I'm Matt Roy with Blue Ocean Benefits and Consulting. Today we're going to talk about...
I don't love it. He doesn't love it.
I didn't love it. I got off track on it. So I want to do it again. Can we do it again?
Yeah, well, I'm still recording. So
I know. Well, you can just delete the whole thing. Okay. That's okay. That's what we're doing. Okay. Hi, I'm Matt Roy from Blue Ocean Benefits and Consulting. Today we're going to talk about why health insurance and capitalism are actually in conflict. You hear a lot about health insurance in politics. They talk a lot about it. It seems that people who are for free markets are generally for, hey, just let the system work itself out, have doctors and hospitals compete. And then people who are generally of a more socialist viewpoint, I'm not saying socialist, but just that direction, want more health insurance. Maybe they want universal health care. They want the government to run it. So what's the right answer? Should health insurance be just a capitalistic thing, or should it be all run by the government, or what? The truth is that capitalism and health insurance don't really work together at all. And that's primarily because the consumer, which is you, does not pay the bill to the provider in any kind of large claim, right? So in a small claim, you might have a deductible and you might have to pay a couple $100 or $50 or whatever. So, you might be worried about that. But if you have any kind of large claim, you have a $400,000 claim, you're more than likely to hit your maximum out of pocket. In fact, you almost certainly will. And once you've hit your maximum out of pocket with your health insurance carrier, you're done for the year. So, for example, I have a $3,500 deductible, and this year I had a couple of minor things that I had to get done, and I knew that I was going to have another minor surgery at some point. It's not urgent. So I decided to do everything in 1 year because I can hit my $3,500 deductible, and after that, my plan's zero. So zero from me. So I'm incented to do as much as possible this year, right? Because once I hit the $3,500, it's no cost. Where if I spread it out, it'll cost me more. So the idea that you can just apply capitalism to health insurance and say, well, if we have enough competition, the rates will come down. And I'll give you this example. If you have a $45,000 hip surgery and your maximum out of pocket is $5,000, you're going to pay $5,000. The hospital's going to pay $40,000. I mean, the insurance carrier is going to pay $40,000. You're going to pay $5,000. The insurance carrier is going to pay $40,000. If you could get that down from 45 to 42 at a different hospital, do you have any incentive whatsoever to do that? Right now, you don't. Almost certainly a $42,000 procedure would also hit your maximum out of pocket. Probably a $38,000 procedure would hit your maximum out of pocket. So you as the consumer, the one picking the doctor, the one picking the hospital, the one making the decisions about where you're going to get your care, price doesn't even enter into it. One hospital could be $8,000 lower and better, have better outcomes, and you don't care. You should care about the outcomes, but you won't care about the price. The idea that capitalism can be really involved in health insurance at all, first of all, that right there could show you that it's not really true on large claims at all. It's also true that just the way we behave with health insurance in general, we don't act in a capitalistic way. People don't say to doctors, how much is this procedure? What's your normal price? Can you give me a discount? They basically say, is it covered? And sometimes they say, what's my cost on this? What's my co-share? What's my share after the insurance company pays their part? So you're really not concerned about the price of the procedure. So again, if my doctor does an endoscopy for $400 and your doctor does it for $450, we don't care. We just want to go to who's doing it right, who's doing it well, who we like the best. We never ask them, hey, what's the insurance company paying for this? As long as we know we're not paying more from one place to the other. Just a short video on why you cannot just say, we gotta let the system work itself out. You can do that with other things. You can do that with plumbers and electricians and maybe cars and lots of other things, rent, lots of other things that people, if there's high demand, the prices go up. If there's low demand, the prices go down. But in health insurance, it really doesn't work that way because the numbers are too far out of whack for people, and any large claim at all, people have no incentive to shop around the lowest price. So if you like this video, would you please hit like or subscribe? It helps us out a lot. And if you want to make any comments, you can comment below. I'm Matt Roy at Blue Ocean Benefits and Consulting. Thanks a lot.